Hello everyone, and welcome back for our final presentation for Anatomy and Physiology 2. This lab presentation will cover surface anatomy and heredity. Surface anatomy is one of my absolute favorite topics because this branch of anatomy gives us a way to make a connection between the structures inside of the body and the way we view our bodies from the outside. Throughout the course of this presentation, you're going to see some familiar terms that you likely will have heard about in Anatomy and Physiology 1. But I do hope that there are some terms in this presentation that will be new for you and that you hopefully have not seen before. At the end of surface anatomy, we're going to do a quick transition into the concepts of heredity. Heredity will just touch on a few topics related to the field of genetics. We're going to elaborate a little bit on the process of meiosis, and just scratch the surface on the how and why of genetic variation. Surface anatomy is a branch of anatomy and physiology that focuses on identifying structures from the surface of the body. Certain regions and bone structures can be experienced through palpation and also visualization of the outside of the body. This subject is specifically useful for medical professionals that assess body function. By knowing the proper locations to look for a particular indicator, we can make determinations about the overall health of the body just by looking at the outside. So to give this a more formal definition, surface anatomy can be described as the study of the external surface of the body. Through visualization, palpation, and auscultation, we can make determinations about the organs that lie beneath the surface. You often would have used surface anatomy when you were going through Anatomy and Physiology 1 and learning the muscles and the bones. It's very common that when learning bone markings or other muscles, that you are feeling those muscles and bone markings on your own body. One of the reasons that I always loved surface anatomy specifically is that I always used this to get answers correct on my tests. So just to give these two words another quick definition, palpation refers to the feeling of structures through the skin, and auscultation is when we listen to something that's going on under the skin. An example of palpation would be feeling for certain pulse points to assess the heart rate. Auscultation, on the other hand, is something that we'll do to listen to the heart rate and perhaps check for heart murmurs. We will hopefully remember that from the cardiac function presentation. So with the background that we now hopefully have on surface anatomy, we're going to transition into some of the anatomical structures that we will see on the surface of the body. As I mentioned, some of these structures will likely be new to you, but some you'll already have a fairly good grasp about where these things are. So we'll first go ahead and start with the zygomatic arch. The zygomatic arch was formed by the zygomatic process of the temporal bone and the temporal process of the zygomatic bone. And it can be found just posterior to the zygomatic region. So we can actually feel the zygomatic arch on this part of the face. Just posterior to this is going to be the temporomandibular joint, or the TMJ. This particular joint right in front of the ear is the location where the head of the mandible will sit in the mandibular fossa of the temporal bone. This is another structure that you can experience from the external view of the body. We also have this little fold here just above the upper lip known as the philtrum. The philtrum doesn't serve much of a purpose in humans, it's pretty much just a remnant of evolution. Now as we start to make our way down to the neck, we're going to start to see lots of areas that are in a very similar location. The cervical lymph nodes are going to be the first ones that we're going to see. These can be found just inferior to the ear. And we must remember that thinking back to the lymphatic system, there are going to be clusters of lymph nodes in the cervical region. We also have clusters of lymph nodes in the axillary regions as well as the groin. Next to the cervical lymph nodes, we'll find the facial artery. The facial artery is going to be one of the many vessels that will bring blood out to the structures in the face. The facial artery will be separated by several branches from the common carotid artery, which we can see over here. The pulse point of the common carotid artery, which can be found over here, was a structure that was discussed a few weeks back. This is one of the many places on the human body that we can palpate for the pulse. So if our memory serves us well, the structures on this slide should be fairly straightforward. The sternocleidomastoid muscle is going to attach to the mastoid process as well as the sternum and the clavicle. And we can see that this region right here includes the sternocleidomastoid muscle. The origin and insertion here are what are behind the name of this muscle. This muscle will attach to the most medial side of the clavicle, which can be found right here. And under the clavicle, we will find the subclavian artery and the subclavian vein. These are two structures that should be fairly fresh in our mind at this point. The subclavian artery and vein are named because they travel under the clavicle. And as we can hopefully remember, they're going to eventually pass through the axillary region, where they will be called the axillary artery and vein, and then over here in the brachial region, they'll be called the brachial artery and vein. We also have the sternum, which is found here in the center of the chest, and this tiny bony portion that lies inferior to the gladiolus of the sternum is the xiphoid process. We'll find this structure right in the center of the chest, where the costal cartilages come to meet with the sternum. Another view of the xiphoid process can be found here, and we'll find the gladiolus, also known as the body of the sternum, just above it. We will also have the manubrium, which is the most superior part of the sternum, and right where the manubrium meets the body of the sternum, we'll have the sternal angle. The sternal angle is a structure that you can feel on yourself, and it's going to indicate the location where the ascending aorta comes out of the top of the heart. This will also lie in line with the intervertebral disc between T4 and T5. So by noting this structure, we can have a general idea of where things are at on the inside of the body also. Sitting here in the scapular region will of course be what gives it its name, the scapula. That's our bone that contains the shoulder blade, which is also known as the spine of the scapula. And we'll also find the iliac crest, which was another structure that we would have hopefully discussed in Anatomy and Physiology 1. The top of the iliac crest marks a very important structure known as the supracristal line. You can also call this the supracrestal line, as this is at the top of the iliac crest. This is going to be a marker that we use to indicate that we're at the level of L4. And this can be a very important structure, especially if we're going to be delivering a spinal tap procedure. That's one of the reasons that we'll want to know where this structure is in terms of its surface anatomy. Coursing up the center of the back, we'll have the posterior median furrow. And the posterior median furrow is this indentation or trench that lies along the center of the back. You can see the impression of the trapezius muscle shown here, and we'll find the posterior median furrow shown right in between. So you may remember from Anatomy and Physiology 1, the rectus femoris muscle had this connective tissue line that coursed down the center of the abdomen. That line was called the linea alba. But towards either side, at the boundary of the rectus abdominis, we'll have another line known as the linea semilunaris, and this will course down either side of the abdomen in the area indicated. We also have the costal margin, which is the margin of our costal cartilages that will come up and articulate with the sternum. Quite interestingly, at the location where the costal margin and the linea semilunaris intersect, we're going to find the gallbladder. As we know, the gallbladder sits under the liver, and its primary purpose is to store bile. We see the linea alba indicated over here, and we have another point over here that's going to indicate the appendix. We call this point McBurney's point, and this is right in about the area where the vermiform appendix is going to be coming off of the cecum of the large intestine. I don't need to go over the axilla again, as we've talked quite a bit about this region over the course of this semester. But one structure that we haven't learned is the cubital fossa, right in the antecubital region. You would have likely discussed the antecubital region on your very first day of Anatomy and Physiology 1. The antecubital region contains the median cubital vein, which is often going to be the vein that we'll use to draw blood from a patient. The cubital fossa can be found on the anterior side of the arm, right in that antecubital region. The next surface anatomical structure that we'll find on the body is the anatomical snuff box. This fun little anatomical structure can be found when the thumb is extended and pointed posteriorly. The tendons of the extensor muscles coming down from the forearm will form a tiny indentation in which you can feel the radial pulse. I will let your imagination wander just a little bit about how this structure got its name. So another couple muscles that we learned in Anatomy and Physiology 1 were the hamstring group of muscles and the gastrocnemius muscle. As the gastrocnemius is the most superficial calf muscle, we'll be able to find that muscle over here. And the muscles that make up the hamstrings are the semimembranosus, the semitendinosus, and the biceps femoris. These muscles will be found on the posterior side of the leg. And this group of muscles is the antagonist group to the group on the anterior side of the leg known as the quadriceps. The quadriceps femoris includes 4 muscles: the rectus femoris, the vastus lateralis muscle, the vastus medialis muscle, and the vastus intermedius. We'll see these quadriceps muscles on the anterior leg, and we'll see the hamstring group on the posterior side of the leg. We'll also find our adductor group, which will of course adduct the leg. The muscles included in this group are the gracilis, the adductor magnus, the adductor longus, and the pectineus muscle. This region on the posterior side of the knee is known as the popliteal region. The indentation in the popliteal region is known as the popliteal fossa, very similar to the cubital fossa, which sits in the antecubital region. As we make our way down the lower limb, the 2 bones that can be found below the knee are the tibia and the fibula. The tibia is always positioned medially, and it will contain the medial malleolus, while the fibula contains the lateral malleolus because the fibulas are always positioned laterally to the tibia. Many of the blood vessels on this picture should be fairly familiar. We've learned about the ascending aorta, the arch of the aorta, the thoracic descending aorta, and the descending abdominal aorta. The branches off the aortic arch in the human are the brachiocephalic artery, the left common carotid artery, and our left subclavian artery. We also have our right subclavian artery over here, and our right common carotid artery shown here. Off the subclavian artery, we're going to transition through the axillary artery and eventually into the brachial artery. But as the brachial artery continues down the arm, this vessel will eventually bifurcate into the radial artery, which passes next to the radius, and the ulnar artery, which will pass near the ulna. We can see many of the other vessels that we've learned in this class, including the celiac artery, the superior mesenteric artery, our renal arteries, the inferior mesenteric artery, and the iliac arteries. In terms of our venous drainage, we'll see many other veins that are taking blood back to the heart that can be found in the arm. Specifically, we've got 2 major vessels in here known as the cephalic vein and the basilic vein. The cephalic vein is very, very superficial, and it courses up here on the anterior aspect of the shoulder. The basilic vein will be found a little deeper, and it can be found coursing right here. The cephalic and the basilic veins are met with that median cubital vein, which sits in the cubital fossa in the antecubital region. As I mentioned, this is typically the vein that we will use to draw blood from the arm. The cephalic and the basilic will eventually flow into the subclavian veins. We've got our jugular veins, which will meet with the subclavians to give us our brachiocephalic veins, and then those 2 vessels are going to come together to form the superior vena cava. Down here we'll see our 2 iliac veins that will flow into the inferior vena cava here, and the 2 renal veins that will also supply the IVC as it makes its way back up to the right atrium of the heart. One vessel that you may not have heard before is the posterior tibial artery. As the name suggests, this artery can be found posterior to the tibia. Interestingly enough, we also have a posterior tibial pulse point that uses this artery to palpate for the pulse. Down here on the foot, we have a looping venous structure known as the dorsal venous arch. This is the arch that's found on the dorsal side of the foot, and it's eventually going to flow into the great saphenous vein, which courses up the entirety of the leg, and eventually will dump into the femoral vein, which is one that we would have discussed a few weeks back. The femoral vein will take blood into the iliac veins, which will eventually come together to form the inferior vena cava. We can see on this slide a couple of the pulse points that we have throughout the body. We have the common carotid artery's pulse point and the facial artery's pulse point that can be found just above. We've now seen the brachial artery and the radial artery that will pass closer to the radius. The femoral pulse can be found right here in the groin, our popliteal artery can be felt in the popliteal fossa, and our posterior tibial artery can be found right here behind the tibia. Each of these pulse points can be used to monitor the heart rate as we palpate for the recoil of blood in the vessels. Another very fun anatomical structure is the femoral triangle. The femoral triangle can be found here coursing along the sartorius and up the adductor longus muscle. This is where we're going to find clusters of inguinal lymph nodes, and we'll also find the femoral artery and the femoral vein passing through the femoral triangle. One of our last concepts that we're going to discuss in relation to surface anatomy are the sites that we use for intramuscular injection. Drug administration is something that we need to take into account. Certain drugs can only be administered in certain ways. And when we administer drugs, we want to make sure that that drug gets to where it needs to go. So the sites for intramuscular injections will typically look for large fleshy muscles that don't have major nerves or blood vessels passing through them. 3 locations for intramuscular injection that we'll often use is the deltoid muscle, the gluteus medius muscle, and the vastus lateralis muscle. This muscle tends to be a bit more developed than the other muscles in children, so we'll often be using this muscle in children for intramuscular injection. The deltoid is one of the most common sites for intramuscular injection out of the 3. The last concept that will fall under surface anatomy is the auscultation of bowel sounds. This, of course, is listening to the sounds that come from the intestines. You'll hopefully remember the abdominopelvic quadrants and how we name them. This is our right upper quadrant, our left upper quadrant, the right lower quadrant, and our left lower quadrant. Certain organs can be found in each quadrant, and we can use the contents found in each quadrant to indicate certain conditions that might be coming from organs in those quadrants. Normally, when listening to the bowels, every 5 to 15 seconds, you'll be able to hear the gurgling of contents inside of the digestive system. In the event that these sounds happen more frequently than 5 to 15 seconds, that typically indicates that there's an increase in peristalsis. And on the other side, if the frequency of these sounds is decreased, that can often indicate that there's some type of obstruction preventing peristalsis, moving substances through our digestive system. There are many applications of surface anatomy in the medical field. As discussed, we can palpate pulse points to monitor and assess heart rate. We can use McBurney's point and the supracrystal line to help us identify the locations of underlying structures inside of the body, and we can also use our sites of intramuscular injection to ensure that drug administration goes smoothly. We're now going to move from the topic of surface anatomy into our last topic in Anatomy and Physiology 2, heredity. This topic of heredity will discuss how certain genes are passed on from parents to children. As discussed during the reproductive unit, we're going to have 2 haploid cells coming together to form a new organism. We've got a haploid sperm cell from dad, and we have a haploid oocyte from mom. The beauty of meeting 2 different haploid cells from 2 totally separate organisms is that it gives us the phenomenon of genetic diversity. Genetic diversity within a species is a very good thing. This ensures that as a species, no one individual bug or disease can colonize and spread rapidly through every member of the species. There are 3 topics that we're going to discuss that give rise to genetic diversity in humans, and they are the independent assortment of chromosomes, random fertilization, and the phenomenon of crossing over during meiosis. We're first going to mention the process of independent assortment. Thinking back to the concepts of meiosis, we'll have a diploid cell that will contain 23 replicated chromosomes from mom and 23 replicated chromosomes from dad. Our diploid reproductive cells are going to assort those chromosomes into 4 separate haploid cells. Independent assortment means that only one cell is going to get this chromosome and another cell is going to get this chromosome. So you'll have 2 different haploid cells that contain 2 different sets of chromosomes. And in fact, every single haploid cell is going to get a different version of the same chromosome. The implication of this is that every single haploid cell will be unique in some way. We can see over here that we might get 2 chromosomes from mom and a 3rd chromosome from dad. But over here we had 2 chromosomes from dad and only 1 chromosome from mom. Independent assortment extremely decreases the likelihood that 2 haploid cells will share the same chromosomes. We can put the number 2 to the 23rd power, and that gives us how many possible combinations of chromosomes can come from one diploid reproductive cell. The fact that all of our chromosomes are mixed and matched between mom's set and dad's set is just one of the factors that leads to genetic variation among humans. The second factor that contributes to genetic variation is random fertilization. Random fertilization refers to the fact that out of all of the millions of sperm cells that are produced, only a single one of them will be the one that fertilizes the oocyte. on top of already having millions of haploid sperm cells, all with different arrangements of chromosomes, completely at random, one of these sperm cells will be the one to penetrate the egg cell. This will also bolster the case of genetic variation. The last factor that we're going to discuss that gives rise to genetic variation is the phenomenon of crossing over. We can imagine that this green chromosome is from Dad and it holds Dad's genetic information, and we can imagine that this purple chromosome is indicating Mom's chromosome and it contains her genetic information. After the S phase of interphase, each of these chromosomes will be replicated, and we call Mom's chromosome 1 and Dad's chromosome 1 homologous chromosomes. Once both Mom and Dad's chromosomes are replicated, we'll have homologous chromosomes between Mom's chromosome 1 and Dad's chromosome 1, and will also have their own individual sister chromatids. When bound together and ready to be independently assorted into different haploid cells, we will often see the phenomenon of crossing over occur during meiosis. We see this shown by the purple and green chromosomes switching places, and this will actually end up leading to two different individual chromosomes that never actually even existed in Mom or Dad. We'll completely trade a part of Dad's chromosome for a part of Mom's chromosome, and this gives new individual chromosomes that will further increase genetic variation among a population. That will conclude our final lab presentation on surface anatomy and heredity. I just want to remind you all that if you're struggling with any of the concepts in my course, I very much encourage you to reach out to me and let me know if you need any assistance. I have very much enjoyed having each and every one of you in my class this semester, and I'm always here to help if you ever have any questions for me.